So the third component, yes.
I'm wondering about my husband's going to have a knee scope.
Mm-hmm.
Is this PRP stuff something that should be done before a scope is tried, or is it something that could be done afterward to promote healing?
That's a great question, actually. It depends on why you're having the scope, okay? If you've got a meniscal tear, if you've got some what we call chondromalacia, which is early osteoarthritis, but if it's a meniscal tear, it's a mechanical irritant. It's an irritation that you feel clicking, you feel popping, you have sometimes, it also depends on the type of meniscal tear that you have, which can best be determined by physical exam and by MRI. So the answer to your question is that if there's a mechanical irritant, I would recommend doing the knee arthroscopy first, okay? Because then you kind of, first of all, you look right in there with the scope, you see what's going on, you address any mechanical irritation that you have, so you're basically kind of optimizing the knee in doing that. Then, but let's say you do have some mild to moderate osteoarthritis in that joint as well, and you're kind of cleaning that up, you're buffing and polishing, you're getting any loose articular edges of cartilage, you're smoothing that down, and so now you're kind of optimizing the mechanical movement of the joint, of the knee or the shoulder or whatever. Then let's say that you are a month down the road, you're 2 months down the road, you're still having some swelling, you're still having some pain, it's just kind of annoying. Yes, absolutely, that's a benefit for that. And then you know kind of more what you got in the joint as well. So that's kind of how I look at things also as an orthopedic surgeon. If somebody comes in and they've got knee pain and they've got a meniscal tear, I'm going to recommend scoping it first. And if it gets better on its own, fantastic. If it doesn't, if it's still bugging you, you have these other parts, components, mild to moderate osteoarthritis with that or whatever, okay, then PRP or whatever is a fantastic option. Okay, so the last procedure, I know you guys we got to get closing up here.